This module will talk about potential complications of hip replacement and their prevention. Infections can occur in about 0.5 to 1% of patients after hip replacement and typically occur either in the first 8 weeks after surgery or years later. Risk factors for infection include morbid obesity, poorly controlled diabetes, conditions or medications that suppress the immune system, poor nutrition, and smoking. Wound drainage is also a leading cause of infection and should be addressed immediately by alerting your care team. Signs of infection include increased pain, swelling, redness, fevers, and wound drainage. Infections may require surgical debridement and treatment with oral or intravenous antibiotics. The following steps can be taken to prevent infection. Avoid submersing the incision underwater for at least 3 weeks. Monitor your incision for any drainage and alert our office immediately if this occurs. Keep soiled clothing away from your incision. Keep your hands clean at all times during dressing changes. Optimize yourself in terms of the nutrition and supplement recommendations in the preparation section of this guideline. Stop or reduce smoking prior to surgery, and address any dental issues such as cavities or gum disease prior to surgery. Major blood loss is not common after hip replacement, and the risk of needing a blood transfusion is less than 5%. Some blood loss is expected and may lead to some fatigue in the first weeks after surgery, which is normal. Your body will build back its natural blood stores in time. Damage to major blood vessels at the time of surgery is extremely rare. Damage to major motor nerves around the hip is also very uncommon, but injury to the sciatic or femoral nerve can occur in rare cases. Also, on rare occasions, patients may have weakness in the muscles of the upper leg after surgery due to motor nerve blockade by the local anesthetic that is placed at the time of the operation. This will generally resolve within a day. Blood clots are rare after joint replacement but can happen to anyone. Blood clots in the leg are dangerous because they can travel to the lungs and cause a pulmonary embolism. Symptoms include increased calf and thigh pain and swelling, throbbing, and increased warmth. If patients develop signs and symptoms that may suggest a blood clot, we will order an ultrasound study to evaluate for this. Alert your care team if you develop increased calf or thigh swelling with pain and warmth. Patients who develop a blood clot will need to be treated with anticoagulant medications for up to 6 months. All patients are placed on some form of a blood thinner for 30 days after surgery. For most people, we use aspirin 325 milligrams twice a day. For people with a history of stomach ulcer disease or kidney insufficiency, we may use aspirin 81 milligrams once or twice a day. Patients already taking blood thinners such as Eliquis, Xarelto, Plavix, or Coumadin are restarted on their regular medication the day after surgery. The following steps can lower the risk of blood clots: early mobilization, elevation to reduce swelling, regular exercise and mobilization, and ankle pump exercises. Medical complications can also happen after joint replacement surgery. Surgery is a stress to the body, and patients with medical problems such as heart, lung, or kidney disease may experience medical complications from surgery. Optimization of these medical problems before surgery is critical, as is customization of the care process to prevent complications. Make sure your care team is aware of any medical history that may affect your risk and recovery. Now let's talk about dislocation. Dislocation of the hip replacement can happen in about 1 to 2% of patients and usually occurs in the first few months while things are healing. Risk factors include a history of severe lumbar spine arthritis and/or spinal fusion surgery. You will know if this happens because you will have severe pain and be unable to walk if your hip replacement dislocates. Treatment requires calling 911, going to the emergency room, and having the joint relocated under sedation. Preventing dislocation requires maintaining hip precautions in the first 8 weeks. Fractures can also occur during insertion of the hip implant. Fractures are rare, but occur either at the time of surgery or in the days to weeks after surgery, and also remotely from an injury. Fractures that occur during surgery can generally be addressed by wrapping a cable around the femur bone to stabilize the implant. Fractures that occur later may require surgery to fix the fracture or revise the implant. Weight-bearing restrictions may need to be implemented to protect the bone while a fracture is healing. Leg length inequality was reviewed in the first module, but we will address it again. In order to ensure a stable total hip replacement, it is occasionally necessary to lengthen the leg through the implant. We make every effort to avoid this by blueprinting the operation before surgery. Despite this, sometimes it is still necessary to lengthen the leg to increase soft tissue tension to make sure the hip will not dislocate after surgery. Small increases in leg length of a few millimeters are generally well tolerated. Larger discrepancies may require a lift either inside the shoe or incorporated into the sole of the opposite shoe.